Welcome to the e-learning module of Occupational Health, Environment and Safety. Today, let us learn about addiction. Let's take a look at the key learning objectives. After completing this lesson, you will be able to explain what an addiction is, list the causes of addiction, state the methods for treating an addiction, and explain withdrawal symptoms. Let us understand what an addiction is. Addiction is the repetition of a behavior despite its negative consequences. It is a state of being dependent on harmful substances which are dangerous for a person's physical health, mental health, and social or economic well-being. The various causes of addiction are personal. This includes genes, ethnicity, trauma, mental illness, or upbringing. Environmental. This includes disturbed family, peer pressure, or social environment, etc. Addiction affects us and our society in numerous ways. Let's see how they affect us adversely.
Click each image to know more.
Prolonged drug use can cause permanent changes in the brain structure and function. It causes disability affecting some or many of our organs. Continued addiction leads to sensory distortions, cancer, coma, etc. Addictions also cause various behavioral changes, which may disturb the work and personal life of the addict. It may also lead to death. Some of the commonly used addictive substances are
Click each image to know more.
alcohol. Alcoholic drinks like whiskey, beer, country liquor, etc. are addictive substances that depress the normal functions of the brain. Intake of higher doses causes increased sedation and loss of control, which leads to unconsciousness, coma, and sometimes even death. Benzodiazepines. These are minor tranquilizers like Alprax, Librium, Valium, etc. that act on specific brain regions and lead to chemical changes in the brain. If consumed in higher than prescribed doses, they can depress the areas of brain related to breathing and can cause death. Cannabis. Commonly used forms of cannabis are marijuana or ganja, hashish or charas, etc. Cannabis can disrupt the control of blood pressure, thereby increasing the risk of fainting. As it contains highly concentrated tar, chances of cancer also increases for people addicted to it. Opioids. Opioids are natural or synthetic derivatives of poppy plant used in the form of opium, morphine, heroin, etc. Chronic intravenous heroin users may develop collapsed veins or depressed respiration due to high doses, finally impairing an organ or leading to death. Tobacco. Smoking cigarettes or bidis or chewing tobacco affect most of the organs of human body. Cigarettes contain more than 4,000 chemical compounds and at least 400 toxic substances that can lead to cancer of throat, lungs, or oral cancer. Volatile solvents. These include substances like eraser fluids, glue, or paint remover that produce chemical vapors that are inhaled and used as psychoactive substance. Successive inhalations may lead to breathing difficulty, coma, bone marrow damage, etc. Some common behavioral addictions include gambling, sex addiction, gaming, etc. These addictions lead to giving up of social life, work and responsibilities. It eventually leads to anxiety, restlessness, and distress. Treatment for addictions is done in 3 steps. Let's know what each of them is and how they help a person in de-addiction.
Click each image to know more.
1. Detoxification. It is the first step towards the treatment of de-addiction. It is the process by which an alcohol or drug-dependent person is helped to stop the use of the substance in a supervised manner. It also tries to minimize withdrawal symptoms. 2. Pharmacological treatment. In this stage of treatment, the addict is provided with medication and is under a doctor's observation. Medicines are also provided to control withdrawal symptoms and help the person get rid of the addiction. 3. Counseling. The doctor conducts rounds of discussion sessions where the patient is encouraged to discuss and analyze his or her problems. The doctor or counselor tries to provide positive support and also create pressure on the patient to abstain from the addiction. Such sessions are also conducted with the family members of the addicted person so that even they can understand how to extend their support and help the addict recover. During the process of de-addiction, an addict faces various withdrawal symptoms. Let us now understand what they are. A withdrawal symptom, also called a withdrawal syndrome, often occurs on reducing or stopping the usage of addictive substances or behavior. The common signs and symptoms are increased pulse, elevated blood pressure, nausea or vomiting, sleeplessness, agitated, and anxiety.
Addiction destroys lives. It destroys the addict's life and, more often than not, the lives of those who love the person suffering from addiction. Addiction is analogous to cancer in that it is progressive with signs and symptoms. It is often lethal and it responds to treatment. Sometimes the addiction or cancer returns and we treat it again. The paradigm in our culture has missed the point. No addict ever strives for his or her condition. No small child ever dreams of becoming a heroin addict or an alcoholic. The predominant theory of addiction is as follows. 1. There is a genetic component or propensity. 2. There is a major life trauma, attachment trauma, and any other trauma that follows in life, and emotional disorders and learning disorders that are related, depression, anxiety, ADD, ADHD, and more. 3. There is a drug that medicates these disorders and that gives the addict a sense of ease and comfort, sometimes for the very first time in her life. What we know about addiction as an illness is that it is absolutely a brain disease. As addiction moves from the first phase of ease and comfort, sometimes fun, problems in the addict's life begin to multiply in the second phase. These problems can look like suspensions from school, tickets, arrests, family troubles, relationship troubles, changes in social activities and friends, difficulty at work, lies, extreme changes in behavior, along with other issues including health. Yet the drug is still working to medicate the addict's initial symptoms, so for him, it's worth the price he pays. Over time, the problems increase in both severity and weight. Hospitalizations occur, addicts overdose. They turn to illicit activities to fund their drug habits, selling drugs, stealing, burglary, robbery, prostitution, and manipulating those they were once closest to. They lose connection to family and friends. They lose themselves. Many die. There is no longer any relief from original symptoms, and the guilt and shame have multiplied exponentially. This is phase 3. It's progressive and only continues to worsen over time without intervention. The major difference between cancer and addiction is in the lives surrounding the addicts and the level of destruction that occurs within families. Watching a loved one slowly disintegrate is one of the most painful experiences imaginable. Treatment works, and it doesn't always heal the addict the first, second, or third time. Sadly, we live in a culture that doesn't yet recognize or understand that people who suffer with the affliction of addiction have had little choice in the direction of their lives. We wouldn't treat cancer patients this way. What's stopping us from giving our loved ones with addiction the help they need and advocating on their behalves? Remember that we are talking about our children, our husbands, our wives, and our parents. Let's recommit to helping them get the help they need. Interventions. Medically safe and comfortable detoxifications. Excellent long-term treatment that offers cutting-edge solutions for the disease of addiction. Addiction is not your fault, and it is not the fault of the addict. Let's get them the help they need today and begin to participate in a new paradigm